As April is Esophageal Cancer Awareness Month, I'm going to be answering some frequently asked questions about esophageal cancer. Now, the first question obviously that arises is what exactly is esophageal cancer? Now, esophagus or the food pipe is what connects our mouth to our stomach and helps in the digestion process. The cancer which happens in the esophagus can be of two different types. The first one can be squamous cell carcinoma, which usually happens in the upper one third and in the middle one third of the esophagus. Now, the second one is known as adenocarcinoma, which happens in the middle one third and the lower one third of the esophagus. The first question, or the most important question that patients do ask is, what is my survival with esophageal cancer? Now, the reason esophageal cancer is a bad cancer in our country is because of late diagnosis. In some countries like Japan, where there is a very eloquent and a very robust screening program, you can find a lot of cancers which are detected in stage 1 and 2, whereas in India people tend to ignore their symptoms and then land up in a stage 3 or a stage 4 cancer. The third question that the people do ask is then what are the symptoms that we should be looking out for to diagnose, or go to a doctor for esophageal cancer. Now, the main, diagnosis or the main symptom that esophageal cancer does have is dysphagia or difficulty in swallowing food. Now, if you have got difficulty in swallowing food that progresses over time, it is something that you should definitely go to your doctor to show it out and then get a proper diagnosis regarding that. What are the tests which are required for esophageal cancer diagnosis? The most important test here is to do an endoscopy, which involves putting a tube down your throat and getting biopsy samples and also having a look at the whole esophagus itself along with the stomach and the upper areas of the mouth. That gives us a very good indication of how the esophageal cancer is present. Along with this, we do a PET CT to see how widespread the cancer actually is. Now, along with this, a lot of people do ask is, how did I get this cancer, or is it related to genetics? Now, the cause of these cancers mostly are due to smoking, drinking. Along with that, we are also seeing patients who are obese and have got a lot of acid reflux have esophageal cancers. So if you are having these symptoms, do go out to your doctor and have a checkup to know what are the signs, symptoms, and how to catch up on esophageal.